Oxygen, present at about 21% in our atmosphere, is the essential gas for our metabolism. Without it, we can simply survive. So in this video, you will know everything about oxygen related to your health. So yeah, be ready to acquire knowledge. Oxygen is used up in our metabolism. If you are a health-related student, you will know like electron transport chain or cellular respiration and many like that. Simply, oxygen is used by the body to produce energy. So without oxygen, no energy, no life. It is that simple. But how does the oxygen enter our body and distribute it? Well, it is your respiratory system that makes sure, are you breathing right now? If it is yes, that's it. By inhaling the air, the oxygen is trapped by the hemoglobin in the red blood cells and it is distributed throughout the body, through the blood, through the hemoglobin, which is a very interesting protein. We will talk about them later. So how do we measure our oxygen status? Well, it is done through many tests like arterial, blood gas and others, but the one you can do at home is through this little device called pulse oximeter, which uses a ray of light to measure your blood oxygen percentage, which is normal if you have around 95 to 100% in a healthy normal individual, but 88 to 92% or around 90% if you are a respiratory deficient patient, like if you have asthma, COPD or other respiratory deficiency like them. So it is important to ask your doctor what is normal for you. But remember that when measured with pulse oximeter, remove anything on your nails that might block or disturb the ray, like nail polish or henna. And also, don't use it under a direct sunlight, which might also give false results. Okay, but in a normal individual, below 95% is not good. And if you have under 90%, then you will experience the symptoms of hypoxemia or hypoxia. Both are similar, indicating that you have low blood oxygen level, with only a slightly difference. Here are the common symptoms of both. In this situation, you definitely need oxygen therapy. And you can get oxygen therapy either with this oxygen tank filled with liquid oxygen or compressed oxygen and oxygen concentrator like this, which produce oxygen by the surrounding air. I will post some links in the description as well as in the comments to the YouTube videos to let you know how to set up and use them. But there is always a flow meter which controls the flow of the oxygen from the source, whatever you use. This is important because you won't want to give too much oxygen to an individual because that will literally cause oxygen poisoning or hyperoxia. Here are the symptoms of oxygen poisoning, which can even lead to death. So be careful with your measurements. Speaking of which, this is the recommended level by the CDC for the flow rate, which are given in liters per minute. And the goal is to get around 95% of oxygen or lower in respiratory deficient patients, respectively. Lastly, you can give oxygen to the patients by the nasal cannula, simple face mask, venturi mask, and receiver bag mask. Among them, the nasal cannula is the most comfortable one, while the others are used to increase the oxygen concentration furthermore to the patient. Remember with the nasal cannula that breathing with your mouth can reduce the concentration of oxygen or produce no use at all. Other than the oxygen supplement, you can do some other things like proning to increase the efficiency of your lungs to increase oxygen intake. So be sure to subscribe to my channel because more health related knowledgeable videos are coming up, and share this video to the others so that you can be part of our healthy league. And as always, stay safe, stay healthy and be ready to acquire knowledge.